Desai to join us. Let's see. There she is.
There we are.
Hi.
Hi, how are you?
I'm very good.
How's it
Good. Are you
going?
in clinic today?
I am, yes. So
Okay.
taking a little break here.
Amazing. Okay, well, we're so excited to have you. We're so grateful to have you, Dr.
Thank
Desai.
you.
And thank you for joining us today. It's going to be a great one. I feel like the conversation is ripe and really important. And I think that everybody joining right now will be really interested to hear your perspective, given how much experience and work and patient advocacy you've done for this topic. So we're so excited.
Thanks so much for having me. Absolutely. It's a huge passion of mine. I think anyone who's talking to me says I can hear that passion in your voice because it's not only my patients and what I do, but it's also something I'm going through myself. So,
Yes.
that always makes it makes it a lot more meaningful too.
Amazing. Okay, well, if you don't mind, can I start with a little bit of a bio on you, because your resume is not even normal, and everybody tuning in, hi, Dr. Desai is incredible. So I'm going to start. Dr. Sejal Desai is a double. Oh, where'd you go? There you
Oh,
went. Okay,
sorry.
good. No, you're good. Is a double board certified, which just being single board certified is one thing. She just went the extra mile and became a double board certified family medicine physician. And then also what we're going to talk about a lot today is an obesity specialist, which in and of itself is a whole nother classification of medical training. She is also the founder of the Tula, I'm going to get this completely correct, Tula Medical Weight Loss and Wellness Center in Katy, Texas, which she just opened. And we are so proud of the work that she's doing for her clinics. And she's just incredible for founding this so that women have a place to go. So that's really wonderful. And congratulations again on opening your new clinic. She is the president of the Houston Obesity Society. Amazing. And the co-founder of the Women's Physicians Entrepreneurs of Houston, which is incredible. And the vice president. I don't know how you're sleeping, by the way. I really don't. And then she was the top doc for obesity in Houstonian. Am I saying that correctly?
Estonia.
Thank you,
Estonia.
Houstonian magazine in 2024. So she is checking all the boxes in terms of the work that she's doing specifically for obesity and for women in perimenopause. So we're so grateful for her. And if you don't mind, can we start kind of at the very beginning, which is the why, which is why so many of us, and we get this so much within our community, is why the sudden weight loss? Like, why was I eating the same things, doing the same amount of exercise, doing my same routines, and then all of a sudden 5, 10, 15, 20 pounds just arrived unannounced in this transition that we're going through?
Yeah, that's such a good question, and the really biggest question that I get asked all the time, right? So why the weight gain? Why? Where did it come from? Why did it come? And why is it always around my belly area, right?
Yes.
Because that's the area that women find it. So, the changes that happen during the menopausal transition, which is basically we start with perimenopause, which can really be in your late 30s to early 40s, where we start seeing the fluctuating hormones, where estrogen is just really fluctuating all over the place, and we're starting to feel symptoms until the point where it goes down so low that you don't have a period for a whole year. That day is called menopause, and everything after that is postmenopause. So as women go through this transition, so much is happening in our bodies, and it's really multifactorial, right? There are many different things, hormonal, metabolic, lifestyle changes. There's so many things going on. But one of the biggest things that's happening during this time, as that estrogen level is lowering, is we are becoming more insulin resistant. Our bodies become insulin resistant. It basically means that the cells of our bodies are not responding appropriately to the hormone insulin anymore. And that causes excess sugar to build up in your blood. And as that estrogen lowers, you get more abdominal obesity because it causes
Mm-hmm.
fat deposition, especially around the waist
Yeah.
area. And then that insulin resistance continues to get worse. And there are so many things also happening due to estrogen loss that make insulin resistance worse. We get muscle
Yeah.
mass loss. That makes our insulin resistance worse. We have sleep disruptions, sometimes due to the perimenopausal symptoms, things like hot flashes, night sweats, insomnia, all these things.
Check, check,
Um,
check.
check, right? I know, me too. I had it too. Urinary frequency, all these
Yeah.
things prevent us from getting that good quality sleep. And we know sleep is very tied in to our weight and to insulin
Right.
resistance. And so all of that makes it worse. And during this time, estrogen also affects our anxiety levels, stress levels. So we're not able to handle stress and anxiety the same way that we used to. And that causes your insulin resistance to get
Right.
worse. And so with all of these things going on in our body and insulin resistance getting worse, we get more fat deposition,
Right.
causing more weight gain, just increasing our metabolic risk for things like diabetes and heart disease and so many other things that
Yeah.
go along with it.
Yeah. It's such a I think that women oftentimes feel like they're out of control, right? There's this notion of I didn't do anything and I didn't want to do this. I haven't, why is it happening and what is in my control? And I think this kind of leads us into this next conversation around GLP1s, right?
Hmm.
Because there's this sense of, oh, okay, now this puts me in the driver's seat potentially, and would love to talk to you at a very basic level. What are GLP-1? Like at its most simplest term, what are they?
Yeah, that's a great question too, because everybody's talking about them, right?
Everybody's talking about it. Yep.
Once Oprah starts, I feel like everyone talks
Yep.
about it. But yeah, they're everywhere. And it's really important to know actually what they are and what they
Yes.
do, because there's a lot of misinformation out there. So I think, that's one of my big passions too, is to clutch some of the misinformation and really get that good information out there, because these are powerful medications.
Yeah.
They're powerful tools when they're used the right way. So GLP is basically, it's called glucagon-like peptide 1 receptor agonist. It's a big, long word. These are medications that help regulate blood sugar, they help regulate appetite and weight. And they work in several different ways. They work in your stomach by helping slow down that gastric emptying so you feel fuller longer.
Mm-hmm. Yep.
They regulate your hunger and, more importantly, actually, your satiety in your brain. That's exactly right. And they improve that insulin resistance that we were talking
Right.
about. They make you become more insulin sensitive. And so
Yep.
that's why these were first used for diabetes. This is when they were developed, and they've been around for a long time. People think that they haven't, that they just came onto
Right.
the market, but they haven't. 2005 was the first approved GLP-1.
20 years
And
ago.
yes, 20 years ago now, right? So, and they were in studies before that, but they've been in use for 20 years, and I've been using them for that long.
Yeah.
We started off with this medication, Byetta, but Byetta was so short acting, we had to inject it 2 times a day. And then
Wow.
yeah, it was a lot. But it was a game changer even back then for diabetes, because we were only using it for diabetes. And then they started making these longer acting versions
Mm-hmm.
of, Byetta, like Trulicity and Bydureon. And then in 2017, Ozempic was developed, and Ozempic, which is semaglutide,
Yeah.
is really one of the most potent ones that we have, and it's still FDA approved just for diabetes, because in 2021 we realized, okay, we really need to start taking this over into the weight management arena, because not only were patients doing great with their blood sugars, but they were losing a lot of weight, and safely losing a lot of weight. And so then they developed Wegovy, which is a specially formulated GLP-1, and it's specifically for weight management. And patients can lose, 10 to 15%. And then came Zepbound. Now, Zepbound is called tirzepatide. It is a GLP, but it is also a GIP. So it's a dual
Okay.
molecule. So it's stronger, it has more effects. And now we're getting into, like the 20%
Hmm.
weight loss, for some patients getting close to bariatric surgery levels.
Wow.
And so it's been, these medications have been amazing. And just to let you know, we're not stopping there. There's a lot more in the pipeline that are coming. There's a triple agonist that's coming, which is going to be amazing. So stay tuned. There's lots more, of these types of medications that are coming out there.
Wow. So, given that, and I'm sure you can rattle off the statistics in your head of the percentage of people in this country who are suffering, who are either pre-diabetic or actually have type 2 diabetes. Type 1, separate situation, put that away. But talk about this rise in use and what happened between, call it, 2017 to today. What do you see happening there?
Yeah, so there's been a lot going on between 2017 and today,
Yeah,
and then especially when Wegovy got approved, there's been a lot and a lot of big changes that have happened. A lot of it is coming from misinformation and misuse of these medications,
interesting.
using them for the wrong patients, and so I think these medications they're amazing medications and they have wonderful benefits.
Mm-hmm.
They have benefits and they have side effects, right? And so these medications need to be prescribed by somebody who is, knowledgeable about the medication, who uses them quite often. And I think that there's been a lot of misuse. And I think everybody is thinking that they can they need to lose like 10 pounds, they're going to go on Ozempic and go and
Right.
lose it, right? Like, let me just take the easy way out. It's not really the easy way out. Obesity is a chronic disease and these medications are indicated for chronic disease use. And so I think there's been a lot of misinformation and not using it in the right patient, and not using it for the right amount of time, not enough guidance given. So, but when we're looking at it from an obesity medicine perspective, there's been a wonderful shift in our patients who actually need the medications and use them the right way and for the right
Yeah.
reason. It's been a game changer for a lot of people. Of course, there are still some, a lot of challenges that we face getting these medications prescribed, access to
Yeah.
care, and
Yeah.
shortages. But we're improving with all of that stuff, and when we work with our patients, one-on-one, it really does. It really can help change their
So,
lives.
Dr. Desai, to that point, and I feel like, this is such an important kind of segue, which is who is the perfect candidate? If somebody came into your clinic and said, "Hi, I'm Melissa Oliveira. Here's my story." What does that archetype look like? What does that patient look like from a patient history standpoint, from a kind of a genetic, construct? What does that person look like that you're like, you know what, you are the ideal candidate for a GLP-1?
So yeah, that's a great question, and there are many different things that we look at. So as obesity medicine physician, I'm looking at the whole patient. I'm not
Mm-hmm.
just looking at somebody to help them lose weight, right? It's really not as much about weight loss as it is about improvement in your cardiometabolic health,
Yeah.
right? So when I look at, let's say, a perimenopausal female, she's already having an increase in risk factors. Cardiac disease goes up after
Yep.
menopause, risk for Alzheimer's goes up, risk for different cancers goes up, right? And so now if this female has been dealing with weight for a long time and is a candidate for obesity, anti-obesity medications in
Mm-hmm.
general, first of all, we have to see if they're a candidate for obesity medications. Do you
Right.
have the disease of obesity? So that's the first thing we have to do, is we have to diagnose obesity. And, obesity is diagnosed in many different ways. The old thinking was that it was just a BMI, which
BMI.
we still do use
Can you just
BMI.
say what BMI is for those people who may or may
Yes.
not know?
Yes. So a BMI is your body mass index. So it's a
Mm-hmm.
ratio of your weight and height. And you can just a calculator online, Google
Yep.
it. You can put in your weight and height. And you can find out your BMI. If you're above 25, you're in the overweight range. And if you're above 30, you have the disease of obesity. But alone, BMI does not
Mm-hmm.
diagnose obesity anymore. BMI is an imperfect tool because let's say you have a lot of muscle mass, right? You're
Right.
going to have a higher BMI, and that may or may not mean that you have obesity. So we use way more than just BMI when we're talking about obesity. We're looking at waist circumference, we're looking at body composition, right? How much visceral fat do you have? That fat around the waist that causes all the long-term problems, right?
Yeah.
How much muscle mass do you have or don't have? That's going to affect your health and your risks. So we use those things. We use waist circumference. We use waist to hip ratio. We take all of these things together, and then we
Yeah.
take our patient and her symptoms or his symptoms, and we decide if this is a diagnosis of obesity. And once we make the diagnosis of obesity, then we talk about anti-obesity medications and which one will be the best one for you. There are plenty of anti-obesity medications. This is not the only one, even though it's the one most talked about in
Right.
media, social media,
Right.
everywhere. There are so many of them, and a knowledgeable healthcare provider needs to really find the one that's perfect for you. And so with something like this, obviously, GLP-1s are great if you have diabetes. That's the first thing. And they're actually covered very, very well by insurance if you
Yeah.
do have diabetes. And they can help tremendously in that case. Also, for obesity, once we make that diagnosis, then it isn't, as long as there's no contraindications, and we can talk about that in a minute too, but as long as there's no contraindications, a patient who has been dealing with their weight for a long time, right? This isn't the
Right.
first thing I'm going to.
Right.
If a patient comes to me, they've never done anything else before for weight, we're always starting with lifestyle. We can never get away from that. Even when we're prescribing medication, we are always starting with
Yeah.
lifestyle. It is the basis of where we start. But the patients who have been trying lifestyle over and over and are getting frustrated, and everybody's just telling them to
Right.
eat less and move more,
Exactly.
right? And they're like, I have been doing that. And either, they're losing the weight, but then they regain it, or they're just not able to lose it to begin with, or they're hitting menopause where now there's all these other changes that's preventing them from really getting good, sustainable weight loss. Because when I talk about weight loss, I'm talking about sustainable weight loss and fat loss, not just weight,
Muscle.
not just the number
Right.
on the scale. So the person who's having that difficulty and who's had that difficulty for a while is probably going to be a candidate for weight loss medications and possibly GLP-1s if that's something that they and their doctor together feel would be
Yeah.
appropriate for them.
And so, in your opinion, once this patient comes in, they're diagnosed officially with obesity. This is not
Mhm.
something that they came in and they're like, look, I gained 10 pounds last year. This is
Right.
a lifetime of really trying. And they've started with the wellness
Mhm.
stuff. They've started with the close in, they've exercised, diet, those sorts of lifestyle changes that you mentioned. So she comes in. What
Mhm.
are the top benefits of a GLP-1 for this patient?
Yeah. There are so many wonderful benefits of these medications, and every single seems like day we're
Right.
finding more and more benefits. So the first thing is significant weight loss, right? So we do see a significant amount of weight loss compared to other anti-obesity medications. There is more weight loss because of the mechanism of action of this molecule. Patients get reduced craving and appetite control. So at the end of the day, they're able to stick to that healthy eating pattern long term.
Mm-hmm.
And, for that perimenopausal woman, I think it's fantastic because as her risk of hypertension, blood pressure, cholesterol, diabetes, and cardiovascular disease risks go up, these medications have been shown to help improve all of those things. And so it's one medication that can potentially help in all these different areas. We do with Wegovy, we have cardiovascular benefit as well
Yeah.
now. The studies are there for that, and I'm sure they're coming for the others soon. These medications are also being looked at for things like fatty liver disease and even, with memory and Alzheimer's and sleep apnea. There's so many different, benefits that we can get with these medications. And so as we continue to learn more and find out more, we're seeing more and more that these medications are really changing the overall health
Yeah.
of the patient if done properly and done safely and effectively.
Well, and I just want to pause here and say it is Heart Health Awareness Month, right?
Yes.
So, and I think that many women, and maybe they're aware of it, maybe they're not, maybe they kind of understand it somewhere in the back here, that 1 in 3 women will die of heart disease. It is the number one killer in this country. I mean, this is, a heavy topic, but it's really, really important to understand that and understand your propensity and risks for cardiovascular disease as a woman, number one. And then that number two, that 80% of, or the risks cardiovascular disease, 80% of them can be mitigated, right? So there's so much that you can do to help prevent cardiovascular disease. And I think that this conversation around GLP-1 and the impact of hypertension or stroke risk or any of these very, very deadly and costly disease states that can be mitigated. And so it's really, really an incredible breakthrough, I would say, for cardiovascular health.
Absolutely. And thank you for bringing that up, because I think you're right. I think, I think as a population, we know that the most common, cause of death for men is
Yeah,
cardiovascular disease, but people don't realize it is for women
they
as
don't.
well. They
It's
don't.
it's
It's higher than breast
shocking.
cancer, right?
Yes.
It's higher than breast cancer. It's higher than smoking related deaths. It's higher than everything else. It is the number one killer for both men and women. And we have to, and postmenopausally, our risk is going up anyways. And if you are a female, if we're lucky enough to live long enough, we're all 100% of us are going to go through menopause. So all of us, our risk is going to go up. It does not matter what your family history was. It does not matter. None of that matters, because
Right.
so much of it, like you said, is our lifestyle. And, as we have, gone through these changes in our technology and all these things going on in our
Yeah.
lifestyle, everything has changed. We are not who our parents were anymore. So if my mom lived to 100, she didn't have any issues, doesn't necessarily mean that I'm not going to. My risks are completely different.
You brought something up, and I think and maybe you could speak to it just briefly, but this notion of cholesterol going up as estrogen decreases,
Mhm.
and that relationship of what's actually going on metabolically in a woman when our estrogen goes down, and secretly our cholesterol starts going up, and we've done nothing. It's not like we're eating bacon
Yes,
for breakfast, lunch, and dinner. That
right.
somehow this is going up, and what's happening?
Yeah. Yeah, that's it. That's the thing. It's all of these, factors that we see going up, because estrogen plays a role in almost every process of our body, it seems like. And
Yeah.
so as we, start seeing these fluctuations through perimenopause, and then the low levels and decline of estrogen through postmenopause, it affects everything. It affects, your cardiometabolic health. So it affects your blood pressure, your blood sugar,
Yeah.
your blood cholesterol. These are all things that are related and need estrogen to function properly. So before, when you didn't have any estrogen fluctuations and you had great levels of estrogen, you were just staying
Yeah.
even, right? You were able to stay even, and you were able to, or if you did start, gaining a little bit of weight, you were able to turn that right
Yeah.
back around and get it right off, and it's no big deal, right? But now, because estrogen is leaving, gone, fluctuating, we can't control that. That's not something we can physically control. And so now we're seeing those, numbers change. And I think that brings another point, is make sure you're getting your, primary care visits. Make sure you're getting your health screening
That's right.
exams done. I'm a, family
Huge.
medicine doctor for 20 plus years. And so that is still at my heart, is every year we need to be getting our physical exam done. We need to be getting our physicals done to make sure we're getting our screening, because that is when all of these things start to change and our risks really start to increase during, again, perimenopause, which could be late 30s, early 40s, and
I'm just
onwards.
going to plug what you just said and hit it home, which is we have a really incredible article on hotpausehealth.com about the critical screenings and tests that women really need to prioritize. And it's so, I think we go to our children's well check visits. We make sure our parents are going to their we're going with our parents to their doctor's appointments. I'm making my husband, I go to his appointments with him. And yet so many women are not doing and reflecting that mirror on themselves. And it is so important to get that baseline, whether it's cholesterol, mammograms, colonoscopies, you name it, that DEXA scan. What are those baselines for you that you need to prioritize so that your family medicine doctor or your OBGYN or your GP can go help and really ensure, like, hey, that shouldn't have gone up. Let's talk about that.
That's right. Exactly. And as women, we need two kind of well woman exams a year, right? We need our well woman exam, which the gynecologist is the expert on, and they do the breast and the pelvic. but that's all they're doing. So you need to see a primary
Yeah.
care doctor, whether that's internal medicine, family medicine, GB, whoever. You need to have a primary care doctor on hand who is taking care of the rest of you.
Yeah.
And so you need to be doing that, once a year. Most insurances
Yeah.
cover preventative screening. So get it done because you're
Get it
paying
done.
for it anyways.
Yeah.
And it's very important to know, because the earlier that we can catch this stuff, or hopefully the doctor is talking about prevention, which is, the most important thing. Hopefully they're talking to you as you're getting closer to these numbers rising, that look, this is what you got to
Yes.
change now, so that you can prevent getting the diabetes, blood pressure, cholesterol as you
Yeah.
get older.
And prevention is really hard. I mean, we are not predicated as a country as, preventative medicine. So I think just putting that lens to your health and this longevity. And the last thing I'll say is, women live a decade longer in poor health than men. And so how do we have this really wonderful longevity, those years that we have strong bones and we have, cognitive function, and we have these really robust health and wellness, wins in our sail because we did that prevention ahead of time. So
Yes.
I think it's really important.
I think,
Okay.
yeah.
Last kind of question in this GLP-1, and then I have a
Uh,
follow up at you at the end. What are some of the risks? I think that with these incredible benefits, and we talked a little bit about contraindications in the beginning, which for those of you who don't know, a contraindication basically is, hey, red flag, maybe this isn't the right fit for you as a therapeutic per se, right? You might have something that kind of flags to your medical team like, this isn't right. So what are those risks for certain people?
Yeah, so anytime as a doctor we prescribe medication, we're always looking at risk and benefit,
Yeah.
right? And a medication is not a good option for somebody if the risks outweigh the benefits,
Yeah.
So every medication, I mean, we're talking about Tylenol,
Yeah.
to chemotherapy, like all
Yeah.
of it has risks and benefits. And so, we have to look at that. And with these GLP-1 medications, some of the most common side effects that we see are GI related. So it's going to be something like nausea or a little abdominal
Mm-hmm.
pain, vomiting, diarrhea. Now, most of these things, go away with time. So it
Yeah.
does help with time. And most of them can be prevented to begin with if somebody's guiding you on your lifestyle, because we have
Okay.
to combine lifestyle with these. But and then there's other things, like there's a potential for muscle loss. And we hear a lot about that, and a lot of people losing muscle on these medications. I will tell you, my patients gain muscle on these medications because I'm monitoring their muscle. I'm doing
Right.
body composition testing to check and see what it was beforehand, and then giving them the guidance to make sure they don't have muscle loss. The reason for the muscle loss, it's not the medication itself, it's the excessive amount of weight loss. So if you lose, whatever pounds, 50, 60, 80 pounds, whether that's through lifestyle or medication, you have the potential for
Yeah.
muscle loss, right? And if you lose more weight, you're going to lose more muscle. So that has to be monitored by somebody, and making sure that's not happening. Same thing with gallbladder issues. You can develop gallstones by rapid weight loss. And so some of these patients are taking these medications, are having rapid weight
Yeah.
loss, and they're developing gallstones. Again, that is something that can be prevented if they're prescribed properly, because rapid weight loss is never a good thing. The faster you lose it, the faster you're going to gain it back. There
Right.
has to be a good, steady amount of weight
Yeah.
loss. That's right. And then there's some rare but serious risks of these
Okay.
medications. One is pancreatitis is one of those things. That's a potential risk. It's very rare. I've been using these medications at least since 2005. And I could say I've had one patient who was taking it for diabetes, who developed pancreatitis. That
Mm-hmm.
patient already had high triglycerides though, and that was a huge risk factor for pancreatitis too. So, but I've had one patient develop that. So it's rare, but it's serious, and it's there. If you've had pancreatitis yourself before, then this medication could be contraindicated
Yeah.
for you, meaning it's not indicated for you, perhaps. And then there's another potential risk, which is medullary thyroid cancer. And this
Okay.
is a box warning that the FDA puts on these types of medications. And that's because in animal studies, there were some cases of medullary thyroid cancer. Now, in clinical trials in humans and in the data that we have with people using it,
Mm-hmm.
this does not seem to be
Okay.
a risk. I'm not worried about my patients developing medullary thyroid cancer. However, if I have a patient who has had a history of medullary thyroid cancer or a condition called MEN, it's like an endocrine neoplasia, if they've had either of those things in
Mm-hmm.
the past or they have a family history, I'm probably not going to use this medication on those patients just to be cautious. But it's not really something that I worry too much about. For the most part, they have way more
That's
benefits than they
risk.
do risks. And when we look at benefits and risk, again, we're not looking at doing the medication and not doing the medication. What we're looking at is taking the medication and what would happen if you don't take the medication.
Right.
So these are the risks I talked about of the medication. And then if you don't take it, obesity can lead to heart disease,
Cardiovascular.
cancer, Alzheimer's
Right.
disease, right? The list goes on and on and on. So that's what we're comparing to when
Yeah.
we really decide if we need to do this or not.
Wonderful.
Yeah.
Okay, this is kind of my final question, which is more about your approach, which, I think you being a HotPause Health medical advisor, which we are so grateful
Mhm.
for your perspective and your expertise and just really providing our community with such a wealth of experience and knowledge. The word wellness is in the name of your clinic. And, I think, when we were first connecting, I thought that it was so beautiful how you really wanted that to be part of the name and just really the holistic approach to it, and would love your perspective on, why wellness is so important when we are talking about weight management.
Yeah, absolutely. So I love to talk about that. Thank you for asking
Yeah.
that. That is because it's at the core of weight management, right? We're doing this because, like you said, we don't just want to live longer because we're probably going to as women, but we live in poorer health. We want to live
Yeah.
longer, but we want to live with vitality and we want to feel good and we want to be, able to do all the things that we want to
Yeah.
do later in life. And to me, wellness is at the heart of all of that. So it's not just about weight loss. It's not just about a number on the scale. I named my practice Tula Medical. Tula, Tula, means balance. And balance to me is really where everything is. And so if we're talking about weight management, we still have to look at the balance of the physical, the emotional, the spiritual,
Yeah.
the mental health, right? So we're looking at this whole balance of your health. We're taking a holistic vision of that, and we're working to improve all of these things so that we can live well into the future and live with vitality long term. So I think that has to be at the core of what we're doing and how we're approaching this. This is not a quick fix. We're
No.
not just, wanting to get the weight off and then we're done
Right.
with it. In fact, that ends up causing more problems down the road. So it's like, just do it slowly. It's not a marathon. It's not a sprint,
Yeah.
it's a marathon, right?
Yeah.
It's a marathon, it's not a sprint. So just do it slowly, but do it right and do it once and for all.
Yeah, with intentionality that and I also, I love your perspective just about weight, which is it's about that whole person, right? It's not the number, it's not your BMI, it's that whole person approach, which I think is so beautiful that you bring to your practice. So how can people find you?
Um, Thanks. I'm on Instagram at Tula Medical Weight Loss and Wellness. I'm on Facebook as well, the same. YouTube, we have a YouTube
Mhm.
channel. Or you can go to my website,
And
www.tulatulw.com.
we're putting everything in, but I just, for those of you who are listening, it's, please go check it out. Dr. Desai has built a beautiful clinic and is a wealth of information and a resource that we're so grateful to have on the HotPause Health Medical Advisory Board. So thank you for joining today. You are amazing. I feel like our next, Instagram live we kind of touched on the wellness, but this mental health, spiritual health, balance in life is so important as you lose that weight. And I think there's this follow-up notion of once, and there've been a lot of interesting op-eds about sexual health in relationship to weight loss partner connection. What happens when that body changes? What happens up here? And I think that that's a really interesting follow-up that we would love to have that conversation.
Absolutely. So many wonderful
Yeah.
follow-ups to all of this. I'd love to talk about any and all of that. It's been a pleasure, and thank you so much for having me.
Thank you for joining us. You're the best.
Have
Okay,
a
we'll
great
talk to
day.
you soon.
Thanks. Bye-bye.
Bye.